Welcome back. Many people go to the same dentist office that their parents went to, and they don't know it any other way.
That's right, but today technology has changed so much, offering better ways to get a confident smile. So joining us now to show us some of the latest technology is Dr. Roberto Monteagudo with WisconsinSmiles. Welcome back to the show.
Oh, thank you. Thanks for having me again.
Yeah, good to see you again. I'm glad that you're back. There's new technology. We talk about the fact that everybody goes to the family dentist. They just do what they've learned, and they don't always go out and kind of seek what's new and happening in the industry. So talk a little bit about why, you know, some of the new technology that you do and why you think people should maybe look around a little bit.
Sure. You know, over the last few years, about 20 years or so, there's been a boom of new technology within dentistry. So it's really interesting what's out there. And we have a lot of our clients that come in, and things like an intraoral camera, which we'll be talking about in a few minutes here, they've never seen their teeth up close. And that thing's been around for over 20 some odd years. So I just wanted to bring a few of the technologies out here. There's a lot more, but because of time, we're just going to go through a few of them here and then tell people what's out there for them.
Okay, and the first one is a CEREC machine. Is that how you say it?
Yeah, this is a really cool machine. This is basically based on CAD/CAM technology. For anybody who's ever had a crown done, for example, you know, you get anesthetized, you get the crown prepped, and then you take impressions, you get all that gook in your mouth. We send that off to the lab. 2 weeks later, the crown comes back, we try it in. If it works, fine. If not, then it goes back. Well, with the CEREC CAD/CAM system, we're able to do the crowns in office. So we could actually prepare the tooth, and without putting impressions in their mouth, we'll take a digital impression of them. And then what we'll do is that we'll actually mill out the crowns. If you look here, there's actually some crowns that we've milled out just for the show. So we try those in, and within about 5 or 10 minutes, these are milled. We try them in. If they fit, either they go to an oven or we cement them into the patient's mouth.
So they are right ready to go.
Office.
In office, within about an hour, 20 minutes or so, you're done.
That means you don't have to wear a temporary crown and come back, you know, 2 weeks later. That's a big seller.
Yeah, and the great thing about it too is that when you do wear a temporary crown, sometimes saliva gets underneath there. We have some invasion with bacteria, so we have higher instances of sensitivity. Not with this. The patient's right there. So usually in our office, they'll watch TV, and in a few minutes we have their crown done and ready to go.
Do a couple of emails, you're good. How about dental lasers? How do those help patients? Yeah,
dental lasers have been around for quite a few years. This is called a diode laser. There are other larger lasers that do other types of work, but I just brought this one in. The thing with dental lasers is, number one, that they're compact, and there's a lot less discomfort.
What is this used for? What do you do with it?
And this one in particular, we use this for more gum procedures. So, for example, somebody has gum or periodontal disease, where you would have sent them out to a periodontist or a gum specialist for surgery. We could actually do a lot of the work now in office without having to do a surgical procedure. A lot less pain, a lot quicker. And the post-operative discomfort is basically nil, nothing.
Something I would think is very important too, if we're moving on, is the oral cancer screening tool.
Yes.
That's what this is, huh?
Yes.
That's this thing right here.
Yeah. Unfortunately, over the last few years, oral cancer is the only cancer that we haven't really seen any movement when it comes to helping patients or the mortality rate. So what happens basically, this is called an Identify, and what it is, it's basically a handpiece that shows out a light, and this light, it's a fluorescent light, and so we apply it to the oral tissue, and any abnormal cells will give us a certain color. So we can actually identify certain areas within the mouth, within what's called the buccal mucosa, or under the skin or the tongue, and we can actually see these things, these areas where it may be cancerous, way before the naked eye could see it. So it's really, really cool.
Is this something you spot, or is this something people request, or is this standard procedure at your office?
In our office, it's basically standard procedure. Everybody, we'll do a screening, and then we'll ask them if they want to go ahead and have the Identify screening tool, and they say yes, and we just do it.
Of course. I would imagine, is the time you use this most often if someone had been smoking for a long time, or does that, I mean, is that kind of the reason that a lot of people started doing this?
That's a really good question. Actually, not just smoking. If you've had drinks in your life, if you're over a certain age, almost anybody over the age of 20 some odd should have an oral cancer screening done.
Okay.
Really,
Important. This right here is called a Carry View. What exactly is? I've never seen this before.
This is really cool. This has been out for about a year and a half, and you know, in dentistry, what we're always trying to do is make things better. So, radiation has always been a big issue in dentistry. So, this is actually a device. Excuse me, that could actually find cavities without using radiation. It's a transluminator. So your tooth is a crystal, and So as you can see, it's a crystal, and so what we do is that we just illuminate on both sides of the tooth, and you can see on the side here, there's actually a cavity right there.
Okay.
And especially if you have a silver filling, for example, when we take x-rays.
So the dark part or the light part when we were looking at that, a cavity?
It's actually the dark part off to the side. So if you look at that tooth off to the side right there.
I can see that to the left.
Yep, you can see it right there.
Oh my gosh.
Yeah, and sometimes these are missed by regular x-rays.
Yeah, and then you don't catch them until they hurt.
Yeah, pretty much. And
then
that's why you need a root canal.
And you want to avoid this. You want to avoid this.
Yeah, exactly.
You don't want to go there.
Exactly. Okay, so that's really neat, and that's something that can help reduce your radiation.
Yes,
and truly help with that.
And it's a great adjunct, you know, especially after we take the x-rays. So
I guess now finally we're going to be talking about this intraoral camera.
Intraoral camera. This is really cool. I mean, I have pretty good eyesight, and I use loupes at the office. And so sometimes when I'm looking at a tooth or looking at a patient, you know, I can see what I can only see. This is a high definition camera that when we place it in the mouth, it really shows us the tooth really up close. And as you can see on the monitor, you know, you could see fractures. You could see how silver fillings, for example, they're starting to fail. And it's a great educational tool. So in our office, what we do is that as the patient is sitting down, they're looking at the TV set, and we're actually going with these intraoral cameras within the entire mouth and showing them exactly what we're seeing.
I think it's good for people to see those pictures. I think it's going to translate into better oral care.
Yes, yes.
Yeah, and you know, a lot of patients, it's still, if it doesn't hurt, then there's nothing wrong with it. That's not the case.
No.
You know, you can
get it before it hurts.
Yeah,
right?
you have to get it way before it hurts, because not then we have to do root canals and crowns. It becomes a lot more expensive. So preventive dentistry is very important.
Save yourself that money and the pain. And here's how you can do that. You can have a free comprehensive dental exam at Wisconsin, or a comprehensive, it's not free dental exam. It requires x-rays and a professional cleaning. It's close to free. It's $75. That's how much it is. It's usually a $312 value at WisconsinSmiles. Here's how you can make an appointment with Dr. Monteagudo. It's at WisconsinSmiles in West Allis. The phone number for that appointment is 414-982-3676. WisconsinSmiles.com is the website. You don't have to just go to the same old family dentist. If you're not happy, go check them out. See how you feel with this new technology. Good to see you again.
Thank you.
Thank you.
Thanks
I appreciate it.
All right.